up until about a year ago, I slept in a regular bed, but I started having trouble turning over in bed while I was sleeping. And it got so that it would take me 10 to 15 minutes to turn from one side to the other. My doctor decided that it might be a good thing to have a hospital bed where I could have something on each side that I could hold on to and help pull myself around. So he gave me a prescription for it, and I took it to the health care provider that I had always used. And he said, and they said that the bidding process had gone through and they did not get the ability to sell hospital beds. Well, I could understand that, but I asked, who can I go to? Mm-hmm. And they said, well, we don't know of anybody in Denton County that got the ability to sell that type of equipment. What I wound up having to do was I bought a used hospital bed off of Craigslist. The provider that we used have become friends, and if I break something or it's just no good anymore, they will loan me equipment free while they fix or repair it, because they're friends. Mm-hmm. And I like using them. I could use somebody else, but there's nobody else. The only other provider that I know of in Denton is a good provider, I guess, but they don't have the repair facilities that ours does. I do not know of another provider anyplace that I could go to. Competitive bidding is something the government likes because it's the least cost. It also is the least service. When you try to force providers to do that type of lowballing, you pay for it by not having service, by not having dealers, by not having the ability to help the people who need it most.
It's very frustrating to try to help him and not feel like anybody else is there.